we talk about drugs, it's usually divided into legal prescription drugs and street or illegal drugs. But of course, many of those illegal drugs were once developed for medicinal purposes. Today, we're finding out about how some of those illegal drugs are being used for medical reasons. Dr. Stephen Bright is from Curtin University. He's a psychologist and expert on psychedelic therapy. So I asked, first up, what is psychedelic therapy?
Well, psychedelic therapy involves a traditional psychotherapeutic context, though there's a preparation for the psychedelic experience. Then the person undergoes the psychedelic experience in a controlled environment with two very well trained psychotherapists who are experienced in working in the psychedelic space, and then they have an integrative period after that.
How would having a psychedelic experience help someone?
Well, it could help people in many ways. I mean, before LSD became associated with the counterculture movement of the 60s and the protests against the US involvement in Vietnam, efforts to curb the counterculture movement by President Nixon made LSD an illegal drug. And this was despite efforts by psychologists and psychiatrists to persuade these authorities to allow them to continue using LSD and other other psychedelics in a therapeutic context. It was to be the start of Nixon's war on drugs and the end of LSD treatment in research. And a propaganda campaign was started which contained a lot of misinformation that has persisted for the past 40 years. But up until that point, up until LSD was made illegal, psychedelic psychotherapy was being shown very promising results in the treatment of anxiety, in the treatment of depression, and also in the treatment of alcohol dependence.
Why was it seen as something that could help rather than just a drug that sent you to another place for a while?
It was through the researchers at the time self-experimenting. So you've got to remember that Albert Hoffman developed LSD or discovered LSD in 1943, and the studies didn't really start getting going until the late 50s and early 60s. And when Sandoz Lab, who Hoffman worked for, realized that they'd created this intensely powerful chemical, they just sent it off to researchers around the world to experiment with. And it was through this research that they began to discover the properties of the drug which had therapeutic implications. And I think primarily those therapeutic implications are through providing people with an alternative perspective when it comes to depression. It also can be effective in that it induces mystical states. And so there's been a international psychedelic renaissance in the past 10 years that's led to the ongoing research at Johns Hopkins Medical School and also at UCLA now, where they are providing the psychedelic treatment using psilocybin in this instance, and they provide it to people with end-stage cancer. So psilocybin is the active ingredient in magic mushrooms, and they've been finding that it is effective at reducing anxiety and improving the quality of life for these individuals. And there's further studies underway, and they're showing positive results. It allows people to die with dignity. It provides them with a mystical experience that makes them feel that everything's going to be okay.
What part of the brain do these drugs, be it the magic mushroom that you mentioned, the LSD, are they all stimulating a particular part of the brain to get this experience?
No, it's quite the opposite. And so it's only very recently that we've been able to conduct brain scans. And of course, this isn't happening in Australia, this is happening overseas in the UK. So while you intrinsically or intuitively think that these psychedelic drugs are turning on parts of the brain, but in fact, what they're doing off is turning off parts of the brain and turning off the filter that has developed evolutionarily, because it's very important that we remain focused on whatever particular thing that we're doing. And by turning off this filter, what it does is it allows unique pathways to fire up within the brain, and that's what allows people to see things in a new perspective. And it could be beneficial in the treatment of depression because depression is often underpinned by entrenched, unhelpful beliefs.
Mm. You're also working with MDMA, known as ecstasy. What are you using that for?
The people that are taking part in the studies at the moment have failed to conventional treatments, and the results are very, very promising. In the first study that was published a few years ago now, of these people who had not responded to two conventional treatments for post traumatic stress disorder, after the MDMA assisted psychotherapy, 83% were in full recovery. So, in many
Mm.
respects, what we're seeing with the psychedelic treatments is that they're providing a cure for the psychological disorders. And in many ways, that may be a barrier to us engaging in psychedelic therapy in Australia. I mean, it's not in the interest of pharmaceutical companies to pursue psychedelic research because the drugs aren't patented, so they're not going to recover any money from
Mm.
conducting the research. But more importantly, pharmaceutical companies would be far better maintaining the status quo in which psychiatric medications are prescribed to people with a mental disorder indefinitely to manage their symptoms. Curing the disorder with a dose of a psychedelic within the context of psychotherapy is a less attractive business model.
Dr. Stephen Bright is from Curtin University. He's a psychologist and expert on psychedelic therapy. This afternoon on ABC Local Radio Queensland, you're with Kelly Higgins Devine, and we're talking about illegal drugs that are being used for medicinal purposes. Dr. Bright, is this a difficult turnaround for many people? Because for decades now, we have been told that these drugs are dangerous, that they can be addictive, that people can basically, have LSD flashbacks, that they can keep suffering at random moments with this, that the drug can take over their life. There's just this fear that what are we unleashing if we say, oh, okay, let's do this? What happens from there? Are we trying to do a small good by unleashing a great evil?
Well, I think a lot of the information people have on these drugs, so I'm talking about LSD, psilocybin, and mescaline as the prototypical psychedelic drugs,
Mm.
is incorrect. And it's part of that propaganda campaign that was initiated by the Nixon government. And the information has become so entrenched that it's persisted for the past 40 years. In terms of that misinformation, what we need to be getting out is correct information about these drugs. And LSD is non addictive,
Mm.
it has low acute toxicity, with no reports of deaths from LSD overdose. In fact, there has been cases where people have accidentally consumed massive quantities of LSD and not had any adverse physical side effects. And the same can't be said about many psychiatric medications, which have a range of adverse effects, including weight gain, drowsiness, diabetes, tremors, and severe effects if the person suddenly stops taking them, which is called discontinuation syndrome. To
Mm.
me, that sounds like it's a more addictive drug than LSD.
With the people that you have worked with, to help them with PTSD, what are they reporting to you after this treatment?
I have not been able to engage in MDMA assisted psychotherapy in Australia because the efforts made by myself in collaboration with psychedelic research in science and medicine has been met with much resistance. So, what I can tell you is about the 150 or so patients who have now undergone the treatment in the US, in Canada, in Israel, in Spain, and I may be missing a few other countries where MDMA assisted psychotherapy is taking place. And it is consistently demonstrating to be an effective treatment, particularly for those people who have not responded to other treatments for PTSD. And when you speak to the people who have undergone an MDMA assisted session for PTSD, they say that it's been life changing, that it's saved their life. There are now more soldiers in the US dying from suicide associated with PTSD than from the war itself in Iraq over the past, 10 or 20 years.
With those people who have PTSD and they're using the MDMA or ecstasy, when that effect wears off, what resets for these people then? What happens that their view changes? Because you would think that it would be maybe an effect of the drug that they felt good for a particular period of time. But if this is ongoing, then something else happens that changes the way they think about whatever has happened to them.
It has a lot to do with the way MDMA works. So, MDMA allows people to re experience the traumatic event. And most traditional psychotherapies at the moment involve exposure therapy. So, we expose the patient over and over and over again to the traumatic event. And it's really difficult for both the psychologist and the patient to be re experiencing this event over and over again. What MDMA seems to do is allow people to re-experience that event and reprocess that event in one session. So it's like combining 12 or 18 sessions into a single session of psychotherapy. One of the MDMA psychotherapists has said that MDMA therapy for a psychotherapist is a bit like for an artist who's only painted in black and white to finally discover colour.
Have there been any negative effects reported by those who've tried this treatment?
There's been no serious adverse effects. There have been some negative effects reported, a little bit of anxiety. In one instance, they had to give somebody an anxiety relieving drug to assist them. But there have been no serious adverse events reported to date.
So what do you see then as the future of these types of treatments?
Well, the future of these types of treatments internationally is pretty obvious. The association that's sponsoring the MDMA trials around the world at the moment is having a meeting with the Food and Drug Administration to move forward with phase 3 trials, multi-site, large-scale trials, and their aim is to have, in the US at least, MDMA, a medicine approved by the FDA by 2021. In Australia,
Yeah.
unless we engage in this research, we remain being left behind these other countries like the US. And, there's so many patients that would benefit from this therapy. It's so important that Australian researchers embrace what is happening around the world, and we no longer become the black spot internationally when it comes to psychedelic science. Because if the FDA approves MDMA as a medicine, what does that mean for Australia? We're not going to have the psychotherapists, people such as me, trained to be able to provide the treatments. So we need to be engaging in the research now before we get left behind.
That's Dr. Stephen Bright from Curtin University, a psychologist and expert on psychedelic therapy